Welcome to Understanding the Self. And for this lesson, this will be the continuation of lesson number 7 as what I was saying sa other video ko. Okay. So, bakit ko siya inati? Inati ko siya kasi masyadong mahaba yung previous lesson and also it talks about love. Okay. And many of you might um interested with in regards to this topic. Okay, so the first question that we need to tackle is what is love? And how would I know if I am in love or if I am falling in love with somebody else, which is I think relevant to the students who are falling in love as of this moment. So, next one would be we know or you might know this person already. This is Nicki Minaj, and according to her song, you feel in love when you feel this kind of way. Okay, like boy, you got my heartbeat running away, beating like a drum. It's coming away, coming your way rather. Can't you hear that boom, boom, boom bass, super bass? Okay, so in regards to this, you feel in love when your heartbeat beats faster. Okay, but is it really this kind of thing na mararamdaman mo lang na kapag in love ka? If you feel your heartbeat ay ganun kabilis, well, for this one, we're going to talk about the chemistry of love. Okay, so let's start with attraction. Attraction is a characteristic that causes pleasure or interest by appealing to a person's desire or taste and causes one to be drawn to the other. So, meaning to say, okay, so we attract to other people because of um, it gains the pleasure that we wanted to. Okay? So, it can be our own taste dun sa appearance dun sa tao na yon. That's why we are attracted to. Okay? And apart from that, what is now a love? We already defined that this might be an attraction. Okay? And we feel that we are in love if we are attracted to other person. Is it a kind of emotion or is it a drive? When we say emotion and drive, most romantic relationships begin with two individuals falling in love with each other. Okay? So, according to Robert Palmer, a singer, he compares love with addiction. Meaning to say, naka-addict daw ang pagmamahal. Why is that? Okay? Later, we'll move or we will tackle why love causes an addiction. This was verified in a study in which 17 participants were madly in love were asked to go to the laboratory and bring a picture of their loved one. Okay, so there was a study na pinakita ang itsura ng kanilang mahal sa buhay. And then what happened to this brain of them nung pinakita yung mga picture na yun? Their brain activity were recorded while they look at the picture of their loved one. The results revealed that when participants gazed at the photo of their beloved, regions in their brain were activated. Those parts closely associated with the anticipation of reward and with focused attention. So meaning to say, nung ipinakita ang mga pictures sa participants na yun na kanilang mga loved one, there is a certain part of the brain na nag-function or nakita na associated doon like sa addiction. Okay? So, meaning to say, same part of the brain ang nangyari sa mga taong in love at saka sa mga taong may addiction ang nangyayari. So, that is why love is an addiction. Okay? So, we know the dopamine system in the brain, which is the same system involved in pleasure and addiction. So, with the same brain chemical na nilalabas ng isang tao, every time na siya ay in love, same with the brain chemical na nilalabas ng isang tao kapag sila ay in the form of addiction. That is why love, according to Robert Palmer, ay addictive. According naman kay Fisher and others, 2016, na-conclude that rather than defining love as an emotion, being in love can be considered a strong motivation. So meaning to say, being in love is not only about an emotion, but also it motivates the person or a drive of a person para i-pursue niya yung isang bagay na yun. Thus, early passionate love is not an emotion in and of itself. Rather, it is best characterized as motivation or goal-oriented state that leads to various specific emotions such as euphoria or having anxiety. Same when you are anxious and same feeling na nangyayari sa'yo when you are anxious and when you are in love. Okay? Same with the brain chemicals that is functioning and nilalabas and kaya siya na-associate doon. So, you may define that to yourself. Is it love is an emotion or love is a drive or nagmo-motivate sa'yo para gawin ang isang bagay na yun? Okay? So, alright. So, we have here three phases of romantic love according to Helen Fisher and their colleagues. Okay? In 1998. Sabi ni Helen and her colleagues ay meron daw mga stages ang love. First one is the last phase. Okay? So, this is described as an intense craving for sexual contact. Okay? So, ibig sabihin, when you first met a person, you would love to be that person or nagkikrave ka na gusto mong makita yung tao na yun, nagkikrave ka na gusto mo siya makasama palagi, and that, according to Helen, that is the first phase. So, hormones that is activated to that is the androgen and the estrogen. Okay, so the pheromones and the senses. The second stage of romantic love would be the attraction phase. It is the period of time during which couples are infatuated and pursue a relationship. The energy and attention is focused on one particular person. So, ibig sabihin with this attraction phase, tumataas ngayon ang dopamine and ang norepinephrine at bumababa ang serotonin. Why is that? It's because of serotonin has a different function ng motivation or the emotion or the brain chemicals of a person. Kasi si serotonin ay in charge sa taong may mga depression. This is the brain chemical that is releases of an individual. Kaya kapag tumataas si dopamine at si norepinephrine, bumababa ngayon si serotonin na in charge sa depression. Okay? So, that is the feeling of anxiousness and also being depressed of a person. So, kapag tumaas si dopamine at si norepinephrine, pababa si serotonin. And the next stage would be the attachment phase. It is a long-term bond between partners. It is feeling of security, comfort, and emotion union. So, meaning to say, in regards to the stages of Helen Fisher, ay from this last phase na kung saan nagka-crave ka to see that individual or gusto mo siya laging makita, and attraction phase na kung saan ang period na to is yung gusto mo doon ka lang sa kanya lagi focus, is the last phase would be the attachment phase. Ibig sabihin, meron ka ng feel of security towards to that person. There's a lot of theory regarding on love, and we identified the Helen Fisher. The next one is the John Lee love style. Number one question would be, anong klaseng type of lover ka or anong klaseng type of lover ang na-experience mo towards sa tao na nakakarelasyon mo ngayon. Okay? So, with that, we have your eros. Ang mga eros type of lover, a romantic and passionate love which emphasizes physical attraction and sexual desire. Itong mga eros lover na to is you are or they are attracted to a person based on their ideal characteristic na meron sila. Halimbawa, gusto mo sa isang tao payat, may muscle, or gusto mo sexy, maganda katawan, and you will be considered as an Eros lover. The pros and cons. Ang pros of Eros is madali siya maka-experience. Ito yung mga tao na naniniwala sa love at first sight. Okay? However, kung ikaw ay type of Eros lover, kung ganun kabilis na ma-love at first sight ka sa isang tao, ganun ka din kabilis detach dun sa tao or may ma-fall out of love dun sa tao. It's because of you are seeking only for the ideal characteristic of a person that you would love to or that you would want to see. Okay? Example dito, this is not a bit example but this picture came from It's Okay Not to Be Okay. Si Gangte and then the witch one. Okay? So, even though that they are not in love because of the physical appearances, there's a story behind of that. You may watch that one. It's a great movie regarding on um, disorder or mental disorder. However, pinapakita dito sa picture na to that this girl is was attracted by the body of Gangte. Next type of kind of love or love style according kay John Lee is the agape. Agape, this is the altruistic and selfless love. When we say selfless love, ibig sabihin is mahal ko yung tao na yun regardless kahit hindi niya sa akin, i-reciprocate ko ano yung nararamdaman or yung binibigay ko sa kanya. That kind of love is agape. He considered the wishes of his partner as more important than his own. He may not have a perfect partner but he will always be there to support and offer his love. This type of love is more acceptable to women than men, according to John Lee. Why is that? It's because of, according kay John Lee, yung mga women ay mas gusto nila na sinusuyo sila. Okay? Kaya mas compatible ang mga agape sa mga babae, according to John Lee. Next would be the storge. Sa storge, this love-related relationship is based on non-sexual affection. The person experiences love as a gradual and slow process. When love is storge, love takes time. Okay? They are the lovers who believes that kung tayo talaga, something like that. And also, all the efforts na nai-invest ng isang tao towards do sa gusto niya is nai-inline sa, an example ko dyan, isang storage bag. Na kapag napupuno yung storage bag ng laman, ng bigay, it might be a material, it may also be an effort or an emotion, there will be falling in love to that person. That's what you call storge. Next is the ludus kind of lover. So, ludic lovers, love is just a game. Okay, something for fun or entertainment. They do not experience jealousy, they do not value commitment or intimacy. They manipulate their partners by lying, cheating, and deceiving. So, ang mga ludus type of lover, they are the people who falling in love or papasok sa isang relationship. It's because of for them, they perceive that as an entertainment or a fun. Okay? They do not experience jealousy because of okay lang na kahit na pumato siya sa iba o makapagrelasyon sa iba, they don't care. Okay? Those are the ludic lovers. Also, this ludic type of lover are the person who always lying, cheating, and manipulate a person. Na even that kasalanan na nila, hindi nila i-admit, and then they're trying to blame on that to their partners. Okay? Next kind of love is mania. This mania, manic lovers always check the partner's whereabouts. Kung nasan ka, kamusta ka, nagagawa mo, something like that. They easily get jealous and their experience of love is out of control. They are easily taken advantage by ludic lovers. So, these are the people who keep on checking the cell phone of their partner, who always check their whereabouts, kung nasan sila, ano ginagawa nila, and usually, etong mania ay natitake advantage ng mga ludic lovers. Kasi, kung in layman's term, si ludic lovers ay yung mga nanggagamit and si mania naman is yung mga type of lover na nagpapagamit. Next would be pragma. Pragma is a practical business-like move. Okay? So pragmatic lovers may plan the best time to get married, have children, and other future plans. So, ang mga pragma kind of lover is like a business-like move. Okay? Gusto nila lahat planado, kailan tayo magkakaanak, anong status ng buhay natin, magkano dapat ang savings, and so on and so forth. So, lahat sa kanila ay dapat planado. Okay? So, that six kind of love style ang tinutukoy ni John Lee. Okay? So, for you, what kind of lover that you have experienced or that you are experiencing right now, or what kind of love that you are giving to the person, or if you have a partner right now. Okay? According to John Lee. Kung meron tayong John Lee love style, meron din tayong tinatawag na Robert Sternberg Triangular Theory of Love, which is sikat. Okay? Sa halos lahat ng theory na dumating regarding on love, kay Robert Sternberg yung pinakasikat. Kay Robert Sternberg, meron tayong this triangular theory of love holds that love can be understood in terms of three components that together can be viewed as forming the vertices of a triangle. The triangle is used as a metaphor rather than as a strict geometric model. These three components are, number one is intimacy, number two, passion, and number three, decision or commitment. Each component manifests a different aspect of love. So, before we move on liking, compassion, and the likes na outside of this triangle, himayin muna natin kung ano ang ibig sabihin ng intimacy. Intimacy refers to the desire to give and receive feeling of closeness, connectedness, and bondness. Okay? In loving relationship. It does include within its purview those feelings that give rise essentially to the experience of warm in loving relationship. Okay, so si intimacy ay ito yung connectedness, if you are connected with the person, if you are feeling close and yung bond nyo is maayos, or not maayos but um, intact sa bawat isa. Okay? Next with passion. So, according to passion, it refers naman sa drive that lead to romance, physical attraction, sexual consummation, and related phenomena in involving relationships. This is hot component of love which can be described as intensely romantic or sexual desire for another person, usually accompanied with physical. So kung si intimacy kanina is more on connectedness towards a person, si passion is more on physical attraction towards a person. Okay? The next is decision or the commitment. It refers to short term to the decision that one loves a certain other and in the long term. Okay, so si commitment is he is decided kung gusto niya na makipag um relasyon dun sa taong gusto niya. Okay? Kung kung i-maintain ba niya na yung love na to or hindi. Okay? So, balikan natin. Sa intimacy, it's more on connectedness. Gusto niya laging makasama lang yung tao. Si passion is more on the physical attraction. Okay, more on sex, more on attraction to a person, romance, kaya siya tinawag na mas hot. Okay? And si commitment, na nakikipagrelasyon ka, it's because of you are decided na dun sa tao na yon. However, despite of this these three um, components ng triangular theory of love, meron din tayo tinatawag na liking or friendship. Okay? Dito sa taas ni intimacy is liking or friendship. Or this is the one that is responsible for intimacy. When the intimacy or liking component is present, but feelings of passion or commitment in the romantic sense are missing, then the type of love is referred to as friendship love. This type of love can be root for other forms of love. Okay, so pag liking lang yung gusto mo dun sa tao, wala kang passion at wala kang commitment. Okay? Kasi nga, responsible si liking or si intimacy kay liking. Next would be infatuation. Kay infatuation, more on passion siya. May passion ka pero wala kang liking and wala kang commitment. In regards to this, it is characterized by feeling of lust lang and physical passion lang towards sa tao. Okay, yun lang yung nararamdaman. But you do not want to have a commitment, yung intimacy mo is absent and the commitment also. So, it's more on, pwedeng mag-sex lang kayo, but nagugusto mo lang siya because of that component na ibibigay niya sa'yo. Okay, or na ibibigay mo sa kanya towards dun sa tao. Okay, so it's more on sex kay passion. Meron naman tayong tinatawag na empty love. Okay? Kay empty love is characterized by commitment but without passion or intimacy. Couples only stay together for their children or other important reason. At times, a strong love deteriorates into empty love. Okay, so empty love is yung commitment lang. Nagsasama lang kayo ng partner mo because of para sa mga bata or kadalasan ito ang nararamdaman ng mga mag-asawa na matagal ng kinasal. Okay, or matagal na sa relationship. Okay, commitment na lang because may pinanghahawakan sila. But wala ka ng intimacy, wala ka na ding passion. Okay? Next one is romantic love. Kay romantic love, meron tayong intimacy and meron tong passion. Romantic love bonds people emotionally through intimacy and physical passion. Partners in this type of relationship have deep conversation that help them know intimate details about each other. They enjoy a sexual passion and affection. These couples may be at the point where long-term commitment and future plans are still undecided. Okay? So, when we say romantic love, ang present lang dito is intimacy and also passion. Okay? Intimacy and passion lang ang meron kay romantic love. However, yung commitment is absent. Next is companionate love. Okay? So, this one is companionate love. Ano meron kay companion love? Kay companionate love, it is the intimacy and commitment. Companionate love is an intimate but not passionate sort of love. This intimacy or liking component and the commitment component of the triangle make up companionate love. It is stronger than friendship because there is long-term commitment. There is a minimal or no sexual desire. This is often found in marriage, where the passion has died, but the couple continues to have deep affection or a strong bond together. This may be viewed as the love between very close friends and family members. Okay? So when we say companionate love, meron tayong intimacy and meron tayong commitment. Gusto nating laging kasama yung tao at andun yung commitment pero wala nang passion or wala na yung sinabi na natin kanina na regarding kay passion. Wala na doon sex, wala nang mga hot scenes na nangyayari. But ang pinanghawakan na lang is the intimacy and then the commitment. Okay? It's more sort of best friends na lang. However, in-depth pa dun yung type of love na meron sa dalawang couple. Next would be the fatuous love. Alright? Kay fatuous love, meron siyang passion and commitment. However, in this type of love, commitment and passion are present while intimacy or liking is absent. So, meaning to say, fatuous love is typified by a whirlwind courtship and marriage in which passion motivates a commitment without the stabilizing influence of intimacy. We hear a lot about this among celebrities. When we say that, may passion, may sex, meron din commitment, pero wala na yung sort of feeling na gusto mo laging kasama or yung trust mo kasi wala kang liking, wala kang intimacy, yung feeling na gusto mo laging kasama yung tao na yon is absent na. Okay? Kasi nga, more on sex lang dito and then more on commitment. And this kind of love na fatuous ay usually nangyayari sa mga celebrities. Okay? According kay Robert Sternberg. The next, so, nasabi na natin ang intimacy, commitment, fatuous, infatuation, empty love, companionate love, or the compassionate, and then the romantic love. So, kung mapapansin natin, lahat ng yun ay may pros and cons. Okay? So, pros and cons, it's because of, like kay fatuous love, meron kang passion at commitment, pero absent naman si intimacy. Kay romantic love, may intimacy ka, may passion, pero ayaw mo naman makapag-commit. Okay, or yung commitment mo masyadong mababa. Kay companionate love naman, may intimacy ka, okay, at may commitment, pero hindi kayo nagsisex. Okay? What is now the best love? According kay Robert Sternberg, ang best love daw that the person or of the couple must possess is the compassionate love or the complete love. Kasi, kaya siya nandun dito sa loob ng triangle. Kasi, sakop niya si intimacy, si commitment, at saka si passion. So, this is now the best love or perfect couples. Okay? According also kay Robert Sternberg, wala naman sinabi na kung anong age range lang nagkakaroon ng isang tao. But he only identified kung anong klaseng love ang napoposes ng isang mag-partner. Okay? Now, we identified different kinds of love. Okay? There's a lot of theory, but this is only few lang. Meron tayong Helen Fisher na sabi niya kanina is ang love daw ay may lust phase, attraction phase, at saka may attachment. Kay John Lee, love style is in-identify niya kung anong klase ang tao. Meron tayong eros na kung saan ay etong mga eros lover na to ay sila yung mga tao na naniniwala sa love at first sight, pero madali din man ma-fall out of love kasi nga more on physical ang tinitingnan. Meron din tayong agape kanina na diniscuss kanina na dito naman is more on selfless love or altruistic love. Gusto niya, receive lang siya ng receive pero hindi siya nagbibigay. And this is most according kay John Lee na gusto ng mga women. Meron din tayong storge na kung saan sa storge sinasabi dito na ang mga na ang type of lover or a type of a lover person is gusto niya naiipon yung trust, naiipon yung experience, naiipon yung mga binibigay and other things. Okay? Ang mga ludus lover is sila yung mga nanggagamit. Ang main niya naman, sila ang nagtitake advantage sila ang tinitake advantage ng mga ludic lover. Okay, sila naman yung nagpapagamit. And meron din naman tayong pragma na kung saan business-like naman ang pragma. Ito yung mga tao na gusto nila lahat planado. Ilan ang magiging anak, magkano ang pera, hanggang kailan, anong oras not anong oras, however, kailan dapat magpakasal, and so on and so forth. That is according kay John Lee. Now, I am summing up lang everything. Okay? So, kay Robert Sternberg naman, sinasabi ni Robert Sternberg na ang tao daw, when he is experiencing in love, is may intimacy, passion, and commitment. Okay? And the best love is the consummate love kasi saklaw niya ang intimacy, saklaw niya yung commitment, at saka saklaw niya yung passion. Kay companionate naman, meron tayong intimacy at meron tayong commitment. However, wala tayong passion. Kay fatuous type of lover, merong passion, may commitment, pero ayaw niya naman makasama yung tao palagi. Usually nangyayari ang fatuous lover sa mga yung trust nila sa isa't isa ay hindi ganon yung foundation nila ng trust is hindi ganun kalakas. Nag-i-stick sila sa relationship because of we're the committed and also in terms of sex. And yung meron din tayong romantic lover na kung saan may intimacy tayo. Ibig sabihin, you trusted that person, sasabihin mo siya ng problema, lahat, pinagkakatiwalaan mo, and then you do sex. But the commitment itself is absent. Okay? Or hindi ganun kalakas or katibay yung commitment ng dalawang magka-relasyon. Next would be, why do we fall in love? Bakit ba tayo nai-in love? So, why do we fall in love? It's a big question. But however, from a biological perspective, there is a part of our brain that is active when people are truly and deeply, madly in love. Okay, it sounds cliche. However, ano ba yung mga brain chemicals na napoproduce ng isang human being every time they feel in love? And now, yun yung pag-uusapan natin for this part. We have here dopamine, norepinephrine, and serotonin. So sabi natin kanina, serotonin is present to kapag masyadong mataas sa serotonin mo is that you are more likely maki-experience ka ng depression. Okay? So kapag mataas si dopamine at saka si norepinephrine, bumaba ang level of serotonin ang isang individual. Okay? So dopamine is responsible for cognitive and alertness. Okay? So, with this dopamine, in-line natin siya sa love, it is a kind of neurotransmitter that are involved in mood, motivation, attention, and excitement. Brain areas that fire when people view a picture of their romantic partner are pathways rich with dopamine. So, meaning to say, that is why there are people who are very much excited makita ang partner nila in life or mga karelasyon nila or crushes nila. It's because of yung brain chemical ng isang taong in love ay naglalabas ng dopamine. Okay? Or ng dopamine. Okay? And also, yung attention niya in regards to that one is that, okay, sorry for that sound. Okay? Sa dopamine, sinasabi na natin kanina is ulitin ko lang, is that this is responsible for excitement, motivation, and mood of an individual. Next will be the norepinephrine. When you say norepinephrine, this is the same drug or this is a neurotransmitter or a brain chemical inside of a person na kung saan responsible or maihalin tulad sa taong nagtitake ng cocaine, amphetamine, and Ritalin. Okay? And kapag si dopamine at saka si norepinephrine is lagi siyang magkabangga. Okay? Neurotransmitter na laging magkaagapay lagi to si dopamine kasi merong concentration, merong alertness, and nag-overlap yung kung mapapansin dito sa circle na to. Okay? So, same silang dalawa na nare-release ng tao if they feel motivated, if they feel or in love sa isang tao. And also, the excitement na nilalabas is same sila. Lagi silang magka-tugma. Now, let's move to serotonin. Si serotonin naman, neurotransmitter associated with mood, obsession, sex, and sleep. Okay? So, ibig sabihin, kay serotonin, it is also low in patients who have obsessive-compulsive disorder and depression. It is believed that passionate romantic love generally lasts to 6 to 18 months based on a study conducted which suggests that people who are madly in love have increased the level of serotonin. Okay, so how does it work? Si serotonin kasi, siya ang in charge naman sa mood, obsession, sex, and sleep. Kapag mataas si dopamine at si norepinephrine, nahihirapang bumababa sa serotonin. Why is that? Kasi nga, in charge si serotonin sa relaxation. So, kung masyado kang in love on that person, ang mangyayari niyan is maglalabas ang ka ng dopamine at saka norepinephrine, pero yung attention mo na ay bababa, okay? Bababa yung relaxation mo, kaya it might be pag nakita mo yung someone you love is you are intense, okay? Tumataas ang excitement mo kasi nga bumababa si serotonin that is in charge for relaxation. So, meron tayong tinatawag na um, phenylethylamine or the PEA. Okay, you have on your handouts. Si PEA, ganito siya. A neurochemical that can increase the level of dopamine and norepinephrine, especially in the pathways involving mood and pleasure. This has been called the love drug because high level of this substance has been associated with love and orgasm and to people who are happy with their relationship. Okay? So, during breakup, ay bumababa ngayon si PEA or si phenylethylamine. Okay, si phenylethylamine rather or phenylethylamine bumababa siya kasi nga si associated si PEA, si phenylethylamine sa kay dopamine at saka kay norepinephrine. So during breakup, kung mataas ang nailabas ng isang individual na or alimbawa is bumababa si PEA kapag nakaka-experience tayo ng kalungkutan. Okay? So, associated to kay dopamine at kay norepinephrine. Okay? If you still have question, may still ask me during synchronous. Now, we have oxytocin and vasopressin. Okay? This neuropeptide released from pituitary gland. The oxytocin causes the uterus to contract during childbirth and allow the release of breast milk. Okay? Why is that? There are people na hindi naman buntis pero nagpuproduce sila ng lactation. It's because of sa oxytocin level at saka level nila is imbalance. You might notice sa taang depressed na maglabas sila ng lactation or ng gatas kahit hindi man sila buntis. And also, if you have watched sa KMJS, yung lalaki na nag-produce ng gatas, kahit lalaki siya, naglabas siya ng gatas, it's because of there is a chemical imbalance inside of his brain. It might be he has a tumor on that one. Bakit ganun yung nangyayari? Ganun yung nangyayari because of regardless if you are male or you are female, human being are still mammal. Okay? So, mas active nga lang ang ang lactation ng mga girls than to boys. Kaya hindi nagkakaroon ng paglalabas ng gatas ang mga lalaki. However, In charge dito si oxytocin and si vasopressin sa kasi silang dalawa ang magka-partner sa brain chemicals na to. Okay? So, orgasm increases level of oxytocin promoting a desire to be with their partner and enhancing the pair of bonding process. Si vasopressin naman is also important pair in social behavior, memory formation, as well as blood um, pressure. So, the question of this one would be, mas madali natin naaalala yung ginagawa ng tao sa atin if we are in love. It's because of nag-re-release tayo ng vasopressin na kung saan nakakapag-formulate tayo ng more information sa memory natin. Okay? And also, yung iba might be, when they're in love, tumataas yung blood pressure nila or pinagpapawisan sila when they see someone. It's because of this vasopressin. Okay? So, magka-partner si oxytocin at saka si vasopressin sa brain chemicals that a person releases while they're in love. Next would be, wala siya sa diagram, is the endorphin. Okay? Para saan tong si endorphin? If PEA or the phenylethylamine and the dopamine and norepinephrine are responsible for cocaine-like euphoria or the feeling of beginning ng relationship, okay? Nasabi natin kanina na may commitment tayo, okay? Or feeling of security, okay? In charge doon si endorphin. Halimbawa, you are more trusted na dun sa karelasyon mo sa partner mo, kaya hindi ka na masyadong naghihinala. Okay? So, being separated from the beloved can make you love sick like an addict who need a drug to maintain the feeling of euphoria. So, euphoria, this is the first stage na nararamdaman ng isang tao kapag in love siya or pagbago pa lang yung relationship kasi mas gusto niya nakikita yung tao na karelasyon niya. Okay? Para mag-stay itong tao na to, even na hindi na ganun kataas yung level ng euphoria na nararanasan ng isang individual na bago sa relationship, ang brain chemical na nagre-release doon ay ang endorphin or the feeling of secured ka na dun sa kapartner mo or a feeling of security. Okay? So, dopamine, norepinephrine, both of these are in charge sa tao na in love na bago. Serotonin would be, this is in charge also na sa relaxation. Kapag mataas or more in love ka sa isang tao or bago yung palang yung relationship nyo, mas mataas si dopamine at bumababa si serotonin. Kasi nga, si serotonin is more on relaxation. Si endorphin naman, kapag nawala na ang excitement, nawala na ang kilig sa dalawang magkarelasyon, ang nag-i-stay na lang doon or ang brain chemical that a person releases or that a partner releases is the endorphin or the feeling of security. Okay? Right. So, next would be the under pa rin siya ng chemistry of love. The psychology of love shows that there are 3 psychological theories that would explain why people fall in love. Okay? So, meron tayong biological, meron tayong social, meron din tayong, syempre, in psychological. Okay? Si psychological, under niya, may 3 bagay daw kung bakit napafall in love yung isang tao. First one would be the behavioral reinforcement theory. When someone receives a reward such as free ride or other favors from another or a positive feeling that he or she has experienced, the better the findings associated with the behavior of a person, the more likely it is for the behavior to be repeated. Ibig sabihin, if a person, halimbawa, ang isang tao, dililigawan niya yung isang tao o yung gusto niya. Kapag ang isang tao, ini-entertain niya yung manliligaw niya, ibig sabihin nun, mas lalo yung nanliligaw dun sa tao, mas lalo niyang liligawan yung tao. Why is that? It's because of the behavioral reinforcement theory. nasasatisfy yung conscience ng isang tao kasi ine-entertain siya ng tao. Kaya gagawin niya is i-repeat niya yung behavior na pangliligo and pagnunuyo dun sa isang tao. Next one would be the physiological arousal theory. So physiological arousal theory, this explains the most acceptable theories about emotions. The body's experience a physiological change first, then people assign an emotion to that physical sensation. It is based on interpretation of the brain. For instance, when a big spider falls in front of an individual, the reaction would be the person might gasp, the heart would pound faster, the breathing would quicken, the brain would interpret an emotion associated to this experience as the feeling of fear. In another situation, a girl happens to see her crush walking by will have the same experience, but the brain may have different interpretation or a feeling of love. Okay, so kung kanina sinabi natin na ang tao ay napopall in love, it's because of the repeated behavior na ginagawa. Si physiological arousal theory naman, in line sa psychological theories, sinasabi dito na napopall in love yung tao is because nagre-release ito ng same component sa taong nakararanas ng takot. Okay? So, ibig sabihin, if you are, sa example natin kanina kay Nicki Minaj na kanta na Boy, you got my heartbeat running away, beating like a drum is coming away. Can't you hear that boom 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 bass or the beating of the heartbeat ng tao na yon? It's because of this physiological arousal theory na same siya ng component na nalalabas na isang tao. Halimbawa, kung natatakot ka, bibilis ang tibok ng puso mo, pagpapawisan ka, tataas yung balihibo mo, same din sa nararamdaman ng tao kapag siya in love, which is ang component ng kanyang body or na nare-release ng brain or nangyayari sa kanya is same with that thing. Okay, so meron tayo not only by biological but also in psychological na nangyayari sa isang individual when they are experiencing love. Okay? And also, in charge sa physiological, ang cognitive and the reaction of a body of an individual. Alright? Next would be sa evolutionary theories. Sa evolutionary theories, this explains that love aroused due to some social biological need. Males tend to look for young, healthy female mates to carry their offspring, and females prefer males who have the resources to support them and their offspring. Kung si behavioral reinforcement kanina, sabi natin na iinlove ang isang tao kasi nga sa repeated behavior, si physiological is nakakaramdam ka ng psychological or ng cognitive, and then the biological or the physical na nangyayari sa isang individual. Kay evolutionary theories, nai-inlove ka, it's because of it is a need na kailangan ma-experience ng isang tao. Sabi sa evolutionary theories, ang male daw, hinahanap nila is yung mga younger na female. Bakit? It's because of gusto nila na may mag-aalaga sa kanila mga anak kapag tumanda na sila. And this female also, gusto nila or mas prepare nila yung mga mas matatanda sa kanila. It's because of it's like security blanket na makakapag-provide ng resources and also makakapag-support sa anak nila. Okay? So, why people do fall in love, it's because of repeated behavior. It might be because of the physical attraction na nangyayari in the cognitive, which is in line sa kay physiological at kay evolutionary theories. It's because of its need na kinakailangan, kaya sila naghanap na ng partner. Okay? So based on social psychological data, factors that will determine with whom people fall in love are physical attractiveness. Okay, so bakit ba nai-inlove ang isang tao according sa study is because of mas tinitingnan or mas na-attract ang isang individual sa taong gusto nila or image na finormulate nila sa kanilang isip na gusto ko i-sexy or gusto ko gwapo, gusto ko maganda katawan, something like that. Which is, according sa study, mas tumitingin daw ang mga lalaki sa mula dibdib o ba rather than sa face value of an woman. Okay? So number one factor would be the physical attractiveness. Second, why do people fall in love? It's because of reciprocity. Ibig sabihin, nai-inlove ang isang individual, it's because of ibinabalik sa kanila yung ibinibigay nila. Halimbawa, nagbigay ka sa isang tao ng chocolate, flowers, or bag, or pabango, and then that person entertain you kung sino man yung nagugustuhan mo, it's a reciprocity kasi nga, ibinabalik niya yung bagay na yon. Okay? Next would be proximity. People fall in love kasi because of proximity. Proximity in a sense na sila yung mas nalalapitan nila palagi. Sila yung mas one call away sa kanila. At sila yung lagi nila nasasandalan every time na may problem sila. And the next one, or the last one, according sa psychological data, people fall in love because of similarities. Okay? So, may same attribute or same traits na meron ang isang tao, kaya niya na gusto or magkaparehas kayo ng factor or ng trait, kaya kayong dalawa ay na-fall in love. Okay? Now, we have here diversity of sexual behavior. Okay, so adolescence is not only a time for physical changes. It is also the period of increased sexual behavior such as preoccupation with sexual curiosity, fantasies, masturbation, and sexual experimentation. This sexual desire may lead to poor social judgment, high-risk behavior, and lack of discrimination. So, one of the necessary task of growing up is learning to cope with one's sexual arousal and to achieve some balance between when and where the properly express and suppress it. Okay, so what does it mean? People, paano ba nakikita ang or sa isang adolescence is more sa kanila ang mag-experiment, mga fantasy na nabuo sa kanilang utak, and sexual curiosity. Okay? That is the thing or that is the time na na-experience yun ng mga adolescents. Ngayon, we have social behavior. It is the sexual behavior involving more than one person. It is generally expressed in heterosexual and homosexual behavior. So meaning to say, you are looking for someone or you are socializing with someone, it's because of you would like or you may want to experience something na pwedeng makapagmunta ka sa mga inuman, and because of the reason why you are inside of that inuman, it's because of not with the friends but because of to look for a partner or to look for a someone that can satisfy your fantasies and curiosities. Okay? Next would be the solitary behavior. When we say solitary behavior, it is a self-masturbation or self-stimulation with the intention of causing sexual arousal. It is a feeling of pleasure and often results in orgasm. It involves only one individual in which done in private. So, si social sexual behavior, nakikipag-sex ka or naglalabas ka ng orgasm to the other person, the solitary behavior is this is more on self-masturbation that could happen to both male and female also. Okay? And it is a feeling of pleasure and often results in orgasm. Okay? Sa madaling salita, pagsasarili, when we say social sexual behavior is you are looking for partner to release that orgasm. Okay, so according to Rosenthal, children may masturbate at a very young age, which may be spontaneously expressed unless or until the child is taught to repress the inhibit this behavior. It was explained that there are therapeutic benefits of or health self-stimulation or sexual pleasure relieves stress and lower blood pressure kapag ang tao daw ay nagmamasturbate. Why is that? It's because of, nasabi natin kanina, na bakit may kagandahan ang pagmamasturbate? It's because of it releases the dopamine and the happy hormone or the good hormone of an individual. Okay? Sabi, there is a myth na mas naiiwasan daw yung prostate cancer if a person is doing masturbation frequently. And there is no enough study yet na nagpapatunay sa gantong bagay na ito. However, there are, adi kasi yung paniniwala in regards doon. Okay? Next will be erotic dreams. These erotic dreams, ito yung um, involuntary or hindi sinasadya mga image na nag-occur while we are sleeping. Ibig sabihin, both male and female nakaka-experience ng gantong erotic dreams once in their life. Okay? So, in regards to this, ito yung sinasabi na sa babae na vaginal lubrication, okay? Or nag-e-erect ang penis or ang titi ng lalaki and nilalabasan sa gabi. However, not all erotic dreams are wet dreams. Okay? And not all wet dreams are erotic. The less often a man masturbate, the more nocturnal emission he will have. Okay? So, ibig sabihin, kapag mas madami kang nagsa-solitary behavior, okay, na we explain kanina, mas lessen daw ang nocturnal emission na nangyayari sa isang individual. Sa lalaki yun. Next will be, however, okay, there are sexual behavior that majority of societies will always consider wrong or deviant. Ibig sabihin, such as having intercourse indiscriminately with several partners and engaging in paraphilic behavior. Okay? So, there are sexual behavior na nako-consider as disorder if it is deviant or hindi in line sa normal na ginagawa ng isang individual. The first question would be, how would we identify abnormal and normal? Abnormal ang isang behavior if and only few ang gumagawa nito or kinukonsider to as deviant ng isang society. Normal ang isang behavior kapag acceptable ito sa society. Okay? So, such that, pumapasok yung mga different sexual disorder sa isang tao or sa isang individual because of nilalabas nila yung sexual urges nila beyond normal. Okay? Now, let's move to sexual orientation. It is defined as person's predisposition or inclination regarding sexual behavior, emotional attachment, or physical attraction to one or both sexes. Okay? So, under of sexual orientation, we have here, excuse, okay, um, oh, hold on. Okay, under sexual orientation, meron tayong homosexual. What is homosexual? Homosexual refers to a person whose sexual orientation is toward another of the same sex. When you say homo, same sex. Okay? S- So, there are two types of homosexual. There is a gay, which is a man whose sexual and romantic attraction is toward to another man, and also lesbian, which is term describe a woman whose sexual and romantic attraction is toward to another woman. That is homosexual. We also have heterosexual. It is a person whose sexual orientation is toward another or the opposite sex. Okay? We also have bisexual. Bisexual is a person who may be sexually oriented to both men and women. Okay? You fall in love with male, you fall may fall in love with another with a woman also. We also have pansexual. Pansexual is a new sexual orientation of person who are sexually attracted to people regardless of their sex or gender identity. So, pansexual are the person na fall in love regardless sa gender of an or sa sexual orientation ng individual. Halimbawa, um, na if you are a guy, na-fall ka sa isang tomboy din or sa isang tomboy or na-fall ka sa isang lalaki, it could be, or na-fall ka sa isang babae, that is considered as pansexual. For this pansexual, sexual orientation is not very much important sa kanila. Okay? They can fall in love regardless of the sex. Okay? When the word pan is came from the Greek word which is all or every. So thus they may also be called as gender blind. Kasi wala silang pakialam kung regardless of the gender, as long as they are sexually attracted dun sa tao, dun sila na-fall in love. Next would be transgender. Okay, you might know this one, which is Kevin Ballot. What is now the transgender? Transgender refers to the broad spectrum of individual who transiently or persistently identify with a gender different from their natal gender. So, ibig sabihin, this is a type of person who are identified themselves na mm, as pinanganak sila lalaki tapos they identify this self na they are women, and then they identify this or the viewpoint of them is they considered as women. They dresses like a women, and they act like a women. So there is a question. What is gender dysphoria? Or is being gay, bi, pan, hetero, pansexual, as I mentioned, okay, inulit ko lang, lesbian is a disorder? Well, we have here gender dysphoria. When we say gender dysphoria, ito yung tao na nakararanas ng feeling of uncomfortable regarding sa kanilang gender. They cannot identify if they are male, female. They cannot identify or they always anxious regarding on their behavior sa kilos nila kasi nahihirapan sila na identify kung ano ba ang tamang gawi, ano ba ang tamang action, ano ba ang tamang pagsuot. Minsan they naiirita sila because of their genital, okay? And they do not know kung saan sila papunta, saan sila patungo. So that is gender dysphoria. That is considered as disorder. Now, is being gay is a disorder or bisexual, lesbian? The question would be, the answer for that question would be answerable by Diagnostic Statistical Manual of Mental Disorder. Before, may tinatawag tayo na DSM-4 or the Diagnostic Statistical Manual of Mental Disorder. In regards to this DSM-4, LGBTQ plus A is considered as a disorder. However, it got revised na sa DSM or the DSM-5 na they are not no longer considered as disorder. It's because of they identify themselves. Inalis na doon yung but still there is a gender dysphoria. Kung if you are categorizing yourself as na ganito ka, or you are pansexual, if you are bisexual, gay, bi, lesbian, what else? Hetero, and so on, you will not be considered as gender dysphoria anymore. Okay? Bakit siya kailangan i-revise? Nagkaroon tayo ng DSM-5. By the way, this DSM-5 is a manual that psychiatrists, psychologists, and other clinicians are using to diagnose a people. Okay, bakit siya kailangan i-revise? Kasi sa DSM-4, mas nalimitahan yung mga pwedeng pasukan ng isang individual na member ng LGBTQ plus A. Okay, kaya siya ni-revise sa DSM-5. Yung opportunities and other things, mas hindi naging katanggap-tanggap nung nalagay siya sa DSM-4. Kaya siya kinailangan i-revise sa DSM-5. Okay? So, now we're going to talk about the sexually transmitted infection. That is also in line sa understanding the self subject that is in line sa sexual self. Okay? We have here sexual transmitted infections. Kapag hindi nagawa na maayos or sabi nga natin kanina dun sa part 1 of the video na kapag hindi na-identify na maayos, na-consider ang mga salita na tite, puke, jakol, tamod, and so on, at mas naging tabo ito sa pananaw ng isang tao, mas nagkakaroon ng risky sexual behavior ang isang adolescents or ang isang tao. Kasi tabu sa kanila pag-usapan ang mga gantong bagay. When we say tabu, kinukulong nila ang salita depending on that generation. Which is, kung babalikan sa previous video, nagkaroon tayo, ikinukulong natin yung salita. Diba? Meron tayong Victorian era na sinasabi sa Victorian era na tinatawag na white meat ang dibdib at black meat naman ang puwet or ang buttocks. Okay? So, bakit kailangan siya pag-usapan? Kailangan pag-usapan, it's because of kailangan maging aware ng isang tao or ng isang community regarding sa mga pwedeng mangyari sa isang tao. Okay? Kapag hindi pinag-uusapan ang mga bagay or kapag sinusugarcoat natin or inahide natin yung mga ganong terminologies. Excuse me. Okay, so before we move on this lesson, there is a patnubay at gabay or the parental guidance, lalo na sa mga below 18 years old na makakapanood ng video na ito. Okay, so if you are below 18 years old and you are not fully aware, you still need a proper guidance while watching this lesson. Now, we have HIV, AIDS. That is under to sexually transmitted infection. HIV came from the human immunodeficiency virus na kapag nag-lead ito ay pwedeng maging AIDS. Okay? However, how a person identify if it's a AIDS or HIV? Kapag ang CD4 level niya or the T cells ng isang individual ay bumaba below 1,000 or depending as I know, below 1,000 or bumaba siya dun sa normal value ng isang tao at may dalawa siyang opportunistic infection such as herpes, genital warts, gonorrhea, syphilis, and others na pag itataka natin mamaya, that will be considered as AIDS. Okay? Also, there is a myth na nanggaling ang HIV or ang AIDS sa isang monkey. However, okay, paano nasabing human immunovirus ito kung hindi naman human ang isang monkey? There is a myth also na galing daw ito sa monkey and so on. There's a lot of news that you would like to search on your own. However, wala naman siyang ganong katibay na evidence talaga. Okay? So, balikan natin. Paano masasabi na may HIV or paano masasabi na AIDS ang isang HIV? Masasabi yung kapag bumaba sa normal value ang CD4 o ang T cells ng isang individual. Ang HIV naman, kapag isa lang ang opportunistic infection mo or wala kang nararamdaman, pero mababa ang T cells mo, that will be considered as HIV. So, bumababa ba ang taong may cancer, ang T cells nila? Kasi mahina. Kasi when we say T cells, ito yung panlaban sa mga sakit. Bumababa ba ang T cells ng isang individual? Wala naman silang HIV or wala naman silang AIDS. The answer would be yes. Yung mga taong depressed, yung mga taong may cancer, yung may taong leukemia, and dialysis, mas prone sila tamaan ng sakit. It's because of yung CD4 level nila or yung T cells nila ay bumababa sa normal level or below 1,000. Okay? Sa iba, sinasabing article is below 400. Okay? However, okay, so kilala ang isang tao na to na si Freddie Mercury na nagka-experience ng HIV that led sa AIDS. Okay? So that time kasi, kailan na ba na-develop ang gamot dito? It is very recent lang. Okay? And also, may tinatawag tayo na ART or antiretroviral therapy. Itong ART na to ang nagpapataas sa CD4 level ng isang tao or ng T cells ng isang individual na may HIV. Okay? Or may isang AIDS. Okay? Kapag niregular mo ang inom ng isang antiretroviral therapy, tataas ang number of T cells mo na kung saan itong mga T cells na to ang nagpa-fight sa mga opportunistic infection na pwedeng ma-acquired ng isang taong may HIV at mahina ang immune system. It is free from DOH and supported by the government. However, ang taong may HIV ba, sabi kanina is can lead sa AIDS kapag hindi naagapan. Pero ang AIDS ba ay pwedeng bumalik into HIV? The question for that or the answer for that question will be yes. Why is that? It's because of the antiretroviral therapy. Bumabalik or tumataas ang level ng isang T cells ng isang tao. So, if that is the case, ano na mangyayari sa opportunistic infection? Ang mangyayari sa opportunistic infection na yon ay nagagamot sila depending if they are considered as virus or they are considered as bacteria. Okay, so what are the opportunistic infections? According to this study, last March 2017, cases among youth 15 to 24 years old, mas tumataas or mas mataas ang reported cases ng male than to female. Okay? However, nag-iiba-iba to as time goes by. And also, tumataas, it's because of tabu nga pag-usapan ito. So, what would happen sa taong nag-iinom ng ART? Okay? So, with this picture, this man is an HIV positive, nakapangasawa siya ng HIV negative. Ano mangyayari sa mga siblings, sa mga anak nila? If that continues taking ART or antiretroviral therapy na nagpapataas ng T cells ng isang individual na may HIV, ibig sabihin yun, there are cases or most of the cases ng pagtitake nila after 6 months of taking ng antiretroviral therapy, there will be considered as undetectable. When we say undetectable, it is untransmittable. This is also supported by WHO and DOH. Okay? So, when we say undetectable, yung number of copies of virus that can pass sa mga tao or sa partner nila and also sa mga child. Ang nangyayari is lessen na, or when we say lessen, it's impossible na to transmit that kind of virus. Kaya they will be considered as negative. However, what would happen kapag in-stop itong ART? Ang mangyayari doon ay tataas ulit yung number of viruses ng taong may HIV and also mahahawaan yung asawa. Okay? So, regarding on that, dapat continuous yung pag-inom ng ART. So, next slide would be genital herpes. When we say genital herpes, it is a sexually transmitted infection caused by a large family of viruses of different strains. Genital strains produce other non-sexually transmitted diseases such as chickenpox and um, mononucleosis. Okay, so this ang genital herpes, it's like mamaso in Tagalog na parang nagtutubig na ma-experience sa isang individual sa genital area niya. Okay? Another example of genital herpes is this one and sa male, and also this is an example naman sa female. Next would be genital warts. This is the same with warts that a person experiencing sa body nila. However, this is experiencing beyond do sa testes or vagina of an person. Okay? And also, both sa genital herpes and genital warts, nagagamot ito. Antibiotic and depending sa mapaprescribe ng doctor. We have here now the gonorrhea. Gonorrhea is tulo in Tagalog. Okay? So, next would be syphilis. Okay? When we say syphilis, there are 4 stages ng syphilis. Syphilis it is a kind of sexually transmitted infection caused by bacterium Treponema pallidum. Okay? Kung hindi magagamot ito, syphilis, maglilid to sa 4 na phases. The primary phase would be sore throat, something like that, or pwedeng mangyari or tumubo sa other areas of the body. Second is magkakaroon ka ng rashes. Third will be a period that can last for several years with no overt symptoms. Ibig sabihin, hindi siya na-notice. Okay? This is an example ng secondary or genital rashes. Okay? Fourth one is cardiovascular diseases, blindness, paralysis, skin ulcer, liver damage, mental problem, and even death may occur. Why? Kasi kay syphilis, it's a kind of virus na treatable naman. However, kapag hindi naagapan, umaakyat ang bacteria sa utak ng tao. Pwedeng mabulag and other things na pwedeng mangyari. Okay, and may lead to death also. Next one is chlamydia. Most common sexually transmitted infection, an organism that spreads through sexual contact and infect the genital organs of both sexes. Chlamydia ay nakikita not only in genital but can appear also in eyes of a person that has chlamydia. Okay? So, but this thing is an example of chlamydia. Okay? And these are now the opportunistic infection. So, paano maiiwasan ang mga gantong bagay? Para maiwasan ang gantong bagay, we have here artificial and natural type of contraceptives. So, contraceptives are medicines and other devices that are used to prevent unwanted pregnancy. Okay? So, we have here oral contraceptives. These are daily oral contraceptives. Some contain estrogen and progesterone. Efficacy nito is 99% effective if used according to instruction. Next, under ng hormonal method contraceptive is the patch. Ang Okay, so the patch naman, it is a small patch you stick on the skin that releases estrogen and progesterone. It stops ovulation and is over 99% effective if used according to instruction as well. Sorry. Mas lessen yung efficacy ng the patch pala. Alright? So, wala akong exact data regarding on that. Next, na under ng hormonal method of contraception with is the ring. Itong the ring is the contraceptive of vaginal ring is a small plastic ring a woman inserts into her vagina every month and releases hormone to stop ovulation. Next is the implant. Etong implant na ito ay nilalagay libre. I'm not sure with libre but meron ito sa barangay health centers. Nilalagay sa loob ng skin ng isang babae. Okay? The contraceptive implant is a small flexible rod that is placed under the skin of the upper arm by a health professional and releases progesterone to start ovulation. To stop ovulation. We also have injectable. Sa injectable naman, the contraceptive injection, which is long-acting reversible contraception and does not depend on you taking it daily. So, all of these hormonal method contraception has side effects. Okay? And sorry, but I'm not familiar with that. You may, if you would like to know other things na positive or pros and cons, you may still want to or you may direct to a physician or in barangay for you to know that one well. I only have here limited information regarding on that. Next is diaphragm. Next is barrier method. Sa barrier methods, ito yung mga nilalagay para ma-block ang sperm na makapag-reach sa egg ng isang babae and pwedeng direct skin naman ito ginagawa at pwede ding outer. Okay, so example of one of the under ng barrier method is the diaphragm. Okay, it is a soft dome made of latex or silicone and used in spermicide. Okay, so pinapasok siya sa loob. Cervical cup, we also have that one. Barrier method, the cervical cup fits snugly over the cervix, preventing sperm from entering the uterus. Okay, so kung ito yung uterus, dito nilalagay yung cervical cup. And we also have male condom and a female condom. Sa female condom, pinapasok din siya, not familiar also kung paano pinapasok ito, but this one is pag erected ang isang male. Also, not only by barrier methods, we also have behavioral methods such as calendar, which is or the calendar method or the reading method. It is a way to determine a woman's most fertile and infertile times by charting a menstrual cycle. Yung binibilang kung kailan ka magkakaroon, kailan ka ulit pwedeng makapagtalik or hindi, kailan ka pwedeng mas mabuntis. We have calendar method. We also have abstinence or celibacy. When we say abstinence, avoidance of sexual intercourse. Hindi ka makikipagtalik. Kaya siya tinawag na behavioral methods. It's more on the behavior of an individual if we will opted to have sex or no. Next would be the outer course. It is a sexual activity that does not include the insertion of penis into the vagina. So other in millennial in terms cuddly, something like that. But there is no insertion or kaya siya tinawag na outer course. Okay? This is the example wala akong makuha. And next would be a withdrawal. However, sabi ng mga nurses and doctors, mas madali daw makabuntis ang mga not by sperm, ang pre-cam. Okay? Why is that? There is a scientific explanation behind on that, and I'm not familiar with regarding that, but I do not know if it's a myth or no. But that is according to a doctor, by the way. And also, yun yung pag malapit ng maglabas ng isang sperm ang isang lalaki, tatanggalin niya yung penis towards dun sa insertion sa vagina and sa labas niya palalabasin. Next would be sterilization. Procedure that make an individual permanently incapable of conceiving or fertilizing a partner. Okay? So, this is an example of tubal ligation sa sterilization. Sa tubal ligation is iniipit itong clip sealing the fallopian tube, yung fallopian tube ng isang female para hindi makapaglabas ng egg cell. Okay? Para makontrol. Next would be, this is an example also ng vasectomy. Okay? So, sa lalaki naman to. Okay? Another one is IUD. Okay? May ilalagay na parang maliit na material inside of the uterus ng isang babae para ma-prevent yung pregnancy. Next would be emergency contraception. Emergency contraception is it's a kind of pill na iniinom after mo makapagtalik. So that is the end of the lesson for lesson number 7. If you still have question, may ask me during synchronous. Okay? And also, what else? For further information regarding on I'm not familiar with methods in contraception, you may go to your barangay health center and you may ask. That is free. Ang alam kong may bayad lang is other thing like injectable, because yung student ko, yung nanay niya daw is nagpapa-inject, something like that. But for further scientific explanation regarding on that, you may go to a physician also. And that is the end for the lesson number 7, sexual self.